We have been brought to our knees by a microscopic virus. That is what the UN Secretary General said last week. This virus has laid bare the risks that we have ignored for decades: inadequate healthcare systems, gaps in social protection, and structural inequalities.
The worst is still to come. And without an effective vaccine, social isolation is the only weapon we have, which brings the idea of access and affordability to the vaccine in less developed countries.
Just like an X-ray, COVID-19 revealed fractures in the fragile skeleton of our societies, exposing falsehoods everywhere, like the notion that we're all in this together.
Health systems were not older persons friendly. Non-communicable diseases, which affect older persons more than any other disease, were not prioritized.
Right now, we have about 6.7% of those who have tested positive to COVID-19 as people over 60, but the mortality is 44.4%, so it's disproportionate. Amongst people who are over 60, 12% of them have succumbed to the mortality, while for those under 60, it's 1%.
4 months after WHO declared COVID-19 a pandemic, the epidemiology of the disease is yet evolving. There are still a lot of learning to do while the virus continues to test governments all over the world. Close to 1/4 of the Arab population are classified as poor. The region includes the most water-scarce countries in the world. Moreover, 12 out of 22 Arab countries are in some form of emergency and chronic humanitarian crisis. In this part of the world, and because of significant coverage gaps in the health and social system, a large proportion of older adults continue working beyond retirement. So here, the choice became dying of corona or dying of hunger.
Then look at Latin America. Brazil, unfortunately, at the epicenter with over 80,000 deaths. Mexico, Peru, Chile, all providing very serious concerns. Ages that we have covered already in one of the webinars. It is encapsulated in the message from our leaders. And so what? That is destiny. If all the people die, no problem.
Older people require full integration into social, economic, and humanitarian responses, nationally and internationally. We must share good practices and harness the knowledge we have.
We found that there is universal loss of income, breakdown of financial safety net in unorganized sector, loss of food security, and lack of access to healthcare. More importantly, there are major mental health issues in older people and their caregivers in the forms of anxiety, depression, uncertainty, and people were scared of the next day that what is going to happen to them.
As the state was not present with very quick responses, the communities themselves, even in the slums, even in the suburbs, the indigenous population, and in long-term care facilities, they organize themselves with civil society. What we need is a state that gives response. But in our country, without this response, at least we had some measures to protect our older people vulnerable.
But be reminded that inequality rules again. The Black, the Latinos, the migrants, those that are really under severe constraints are the ones that are being the victims, reminding everybody that there is a very strong gender perspective here, because at the bottom of the hierarchy of healthcare sector, you will find women that have to be exposed, but yet they have to look after their children and their elderly when they come back to very unsatisfactory houses.
Something that started as a health crisis has morphed into an economic crisis, into a social crisis. It's moving into a security crisis. Therefore, we need to find a way to bring all of us together. It has to be multilateral.
We also needed to think about how can we work and partner with the government, with the public sector, because this was a situation where we all needed to work together and we needed to put our energies together.
There is an incredible long way for us to go in terms of mainstreaming aging and older people in our planning. We need a vision for all ages. We cannot frame this as a conflict between younger and older generations. We have to consider the diversity of each group, the inequalities across the life course. We need inclusive systems that do not marginalize others.
We know from past experience that sufficiently bold measures that put people at the center of the crisis response and recovery can lead to better, more equitable, and resilient outcomes for all.
The world needs to come together. It needs to collaborate in research, in development, in implementation, share best practices, learn from one another to build a better world for all its citizens.